Hi guys, Assalamualaikum. So for today, my group and I will be presenting about the pregnancy and exercise protocol. So first, let's go to introduction. There are many studies that shows physical activity or exercises is beneficial for pregnant women. According to Vanessa and James in 2017, the benefits of exercises to pregnant women are including maintain and improve fitness, maintain healthy weight gain, decrease gestational hypertension, reduce back pain, shorten labor time, and reduce the risk of cesarean section. However, there are worries among the pregnant women when performing exercises that they might have miscarriage. Therefore, this protocol is prepared to help the pregnant women to perform exercise safely.
Next, I'll be presenting about the contradiction and the precautions. So the first contradiction is that cesarean section, too low back pressure before pregnancy, urogenital infections, history of pelvic floor or lumbar surgery, malignancy, unevaluated maternal cardiac arrhythmia, chronic bronchitis, poorly controlled type 1 diabetes, extreme morbid obesity or extreme underweight, which is the body mass index less than 12, intrauterine growth restriction in current, then pelvic or lumbar fractures, twins or multiple birth history, specific low back pain, severe urinary incontinence, and anemia. Next, I'll be continuing with the precautions. So make sure to stay hydrated and drink plenty of water before, during, and after the workout. Second, wear a belly support belt, may reduce discomfort while walking or running. Third, avoid become overheated, especially in the first trimester. Wear loose clothes and exercise in a temperature-controlled room. And finally, avoid standing still or lying flat on your back as much as possible. There are few warning signs to discontinue exercise. Firstly, vaginal bleeding, regular painful contractions. Third, amniotic fluid leakage. Fourth, dyspnea before exertion. Fifth, dizziness. Sixth, headache, chest pain, muscle weakness affecting balance, calf pain or swelling. Make sure to stop or seek assistance as soon as you face all this. Thank you.
Assalamualaikum warahmatullahi wabarakatuh, and greetings to Mr. Mohan and my fellow friends. My name is HANISAH binti ANUAR, and I will continue this presentation with the types of exercise or physical activity that can be done by women during pregnancy. First, aerobic exercise like walking or climbing stairs. Second, stretching. Third, pelvic floor exercise. And last, progressive resistive training. So, for aerobic exercise, we do the protocol for walking and climbing stairs. For stretching, we choose the protocol for seated side bend, seated pigeon, modified windmill, modified prayer stretch, calf stretch, and chi exercise. And for the pelvic floor exercise, we choose the protocol for pelvic tilt exercise, wall squat sit, and Kegel exercise. Lastly, for the progressive resistive training, we choose the protocol for the exercise of resistant band rows, wall push-ups, and heel raises. That's all.
Hi, and I will continue with the conclusion. In conclusion, exercise is associated with a minimal risk during pregnancy and is proven to be beneficial for most pregnant women. For instance, according to Agustina 2020, stabilizing exercise such as a pelvic tilt, Kegel, and pelvic floor exercise could help in reducing the low back pain and strengthen the pelvic floor as muscle. Some modification to the training routine may be necessary due to normal anatomical and psychological changes and fetal need. Thus, obstetrician gynecologists should carefully evaluate pregnant women with a medical or obstetric complication before making a recommendation for them to involve in physical activity during pregnancy. Next is our preferences. Thank you. Bye.
Pregnancy exercise protocol demonstration. Aerobic exercise.
For climbing stairs, climb the stairs slowly at even pace and take the stair at one at a time. Hold the handrail with at least one of the other hand for support. Make sure the staircase is well lit and avoid greasy. Do not wear overflowing clothes. For walking, walk in a flat surface area, wear a belly support band, start slowly, maintain neutral posture, and purchase a good shoe.
Stretching. The objective of stretching is to help the pregnant women stay fit, relax, calm, and prepare for labor, and also ease some pain and aches that might be experiencing. Seated side bend. Sit on a bench or stool with a hand relaxed with either side. Gaze at left hand, inhale, and glide the left arm overhead. Repeat with another arm alternately. Do not tilt the body too far. Repeat for 10 times with each arm. Seated pigeon. Seated steady on a bench or stool, place the left ankle on top of right knee. Keep the back sharp and lean forward at waist. Place the left hand on the left knee and gently press the knee downward. Stretch for 10 seconds. Repeat with another leg alternately. Repeat the exercise for 3 times. Modified windmill. Legs spread apart and bend the body forward with both hands on a bench or stool. Sinking back into stretching the back. Engage the abdominal muscle and lift the left arm overhead. Repeat with another arm alternately. Repeat the exercise for 10 times with each arm. Modified prayer stretch. Knees on the ground with the hand reached forward. Sit backward as close to the feet as possible. Open the shoulder by popping the wrist and lean to one side and then the other. Keep the knee and hand stationed and keep the head aligned with the spine. Repeat the exercise with 10 times on each side. Calf stretch. Sit on the ground with the leg wide enough to make room for the baby. Point the toes down to the ground. Hold for 10 seconds and relax. Extend the toes up to the ceiling. Hold for 10 seconds and relax. Repeat the exercise for 3 times.
Hi, my name is NURAIN binti MAHMUD. I'm going to perform Qi or Qigong exercise for stretching. Qi or Qigong exercise actually have 24 posture or maybe more. But in this video, I'm going to perform only 7 posture. And every posture I'm going to repeat for 4 times. For the first posture, breathing in. First, bend the knee slightly and do the sitting on the high stool position. And breathing in until down the belly to absorb the essence. Next is lifting the weight. From the same position, bend the knees a bit lower by your hand facing upwards. Pushing up towards the sky like lifting up the load and back to the start position. Throwing the bow. Bring both hands forward in a circular like pulling a bow and arrow with the both hands. Squeeze the shoulder blades until back. For the fourth posture, pushing the stone tablet. Push one hand to the front and pull one hand back simultaneously and turn the face to look behind. Thrusting into the mountains. Bring one hand around while on the others make a fist and put it at hip level. and then bend the knee and push forward twice. Willows on the wind. Stretch the obliques to the side, left and right, while one hand put on the hip and the other hand on the head. Last posture is riding the horse. In squat position, do a deep squat and repeat for 4 times.
Pelvic floor exercise.
So the first procedure is to lie down on the floor. Make sure your feet on the floor and the knees are pointed to the ceiling. And place both hands flat wide on the floor next to the hips. And slowly raise the buttocks as high as possible. And make sure that you use dominant muscle instead of the buttock muscle. So hold for 5 counts and slowly turn to the starting position and repeat 10 times. Next is wall squat sit, which to strengthen the low back pain and pelvic floor muscles. Firstly, you have to find any walls and sit down like sitting on the chair. Position of the hips and knee 90 degrees. And pressing the body into the wall entire time, hold for 1 minute, repeat 3 times.
Next, we are moving on to Kegels exercise. Kegels exercise was actually initiated and invented by Dr. Kegel, who wanted to strengthen the pelvic muscles. The first step involves tightening the anus as if stopping gas from passing. The anus tightens and the buttock should stay relaxed. Tighten the anus and lift it inwards to feel a squeezing sensation around your anus. The second step is to tighten and squeeze the entrance to the vagina as if you are closing it shut and at the same time trying to lift your vagina inward. Thirdly, tighten the opening where the urine comes out. You may feel the anus and vagina tightening if you do this correct. And finally, now relax your pelvic floor muscles back to resting. Combine these 3 steps for the correct Kegel exercise technique. Make sure to sit tall, not bending, but just to sit tall. Breathe normally. Tighten your anus and vagina. Lift them both in and upwards towards your navel. And tighten and squeeze as if you're stopping the flow of urine at the front. Relax your pelvic floor back to resting. Make sure to do this 10 to 15 times with 3 sets, at least 2 times for the start, and you can slowly progress to 3 to 5 times per day.
Progressive resistive training.
Hi, I am HANISAH binti ANUAR and I will continue the exercise protocol with progressive resistive training.
For the first exercise is resistance bend rows. The objective of this exercise is for strengthening and developing the muscles at the upper back. This includes the rhomboids, then the trapezius and the posterior shoulders. The procedure is sit on the floor with the legs straight out in front. Place the band around the feet and grab the 2 ends of the TheraBand. Keep the back straight throughout the exercise and brace the core. Begin the exercise by pulling the band toward the wrist arm. Drive the elbows back and focus on squeezing the upper back muscles together. Hold this position for 1 to 2 seconds and return to the static position and repeat. The second exercise is wall push-up. The objective is to help build shoulder and chest strength but places a reduced load on the muscles. Now, doing some push-ups against the wall. This modification makes it safe to do push-up during pregnancy, and it's still effective if we do it properly. Make sure that the hands are positioned at shoulder level and the arms are at a 90 degrees angle when moving towards the wall. And make sure that keep a slight bend in the elbows at all times to prevent injury. The last exercise is heel raises. The objective is to strengthen muscles of the calf and knee. The procedure is stand with feet flat on the floor. Exhale as heel raises as high as we can, and then hold pose for a few seconds. Inhale as the heels is lower slowly. When you're ready to move to the next level, use free weight like water bottle. That's all from me. Thank you.